In our hospital, we have traditionally had more limited interpretive services and have relied on the phone, and sometimes that will cause a little bit of problem when you have new situations. And one example of that is we have a room on the pediatric floor called a negative flow room, and certain patients are required to be in that room. One weekend when I was rounding, when I got to the floor, the nurses were in a bit of a uproar. We had a family who was in the negative floor room. It was a immigrant family from Somalia, and they needed to be in the negative flow room because their child had tuberculosis, which was active. And they apparently didn't understand why they were in that room. And it became apparent to me pretty quickly that we were going to need to have better interpretive services to handle that situation. I asked that they get a face-to-face interpreter for us to talk about this, and that's not something that I would have done necessarily historically. Through the Stratus Health initiative, I learned about the class standards for interpreting, and it really had made me more aware that having more limited interpretive services can pose some difficulties, and it clearly had in this case. When we did get the face-to-face interpreter available, it was much more easy to explain to the family why there was a need to put the child into the negative flow room. And it became clear that they had taken it very personally and felt discriminated against. That particular room doesn't have a bathroom, and they thought that they had been put in that room specifically because of who they were, and that we didn't want them to have a bathroom. And by having the interpreter there to read, be able to help both verbally and reading nonverbal cues, we were able to get to that core issue. I think that it helped the entire staff and not just that family. I mean, when I got there, people were literally afraid to go into the room. They had heard rumblings that this family felt discriminated against. They weren't sure what it was that they were doing wrong, what they were doing right. And when they would use the telephone line, you couldn't quite get to where you needed to be. And clearly it became much easier for everyone, and most importantly for the family, to understand why they were where they were, and that what we were doing was really the best for them and their child.